Hey guys, Dr. Earl here again. I'm not going to waste your time today. Give me 4 minutes and I'm going to tell you what is the number one reason people seek medical care. Number one, what is it? Give me 4 minutes. I promise I won't waste your time. Ironically, the number one reason people seek medical treatment is for lower back pain. Do you know how much training your general practitioner has in diagnosing and treating lower back pain? Unfortunately, it's next to zero, which is why everyone gets the same diagnosis: tight muscles, and given muscle relaxers and pain medications without ever really trying to diagnose the problem. Muscles don't just spasm on their own. Unless there's a direct trauma to them, they connect to joints and tendons. So something else has to be going on that is just being ignored by taking muscle relaxers and painkillers. Want to find out more? Stay tuned. One of the first things we do to diagnose lower back pain is see if the patient has one leg shorter than the other. As we can see on this patient, his right leg is shorter than the left by about 1/4 of an inch or so. When you find a short leg on a patient, the next thing that you're going to check for is to see if the pelvis is normally aligned. With this patient with a right short leg, we can feel that his right side of his pelvis is shifted back and the left side is shifted forward. The pelvis is two pieces, right and left, and they rotate in opposition to each other. His pelvis right now is rotated in this direction and stuck. What that does is it causes the right leg to go short. His legs are the same length, he just has it appears to be shorter because of the pelvic distortion here. This is generally going to cause pain coming across the belt line, which is the number one most common source and cause of lower back pain, and comes right across the belt line, and then it will radiate up into the muscles and across the top of the glute muscles. The reason for that is, as the pelvis distorts in this direction, it's going to pull down on the lumbar muscle here and make that super tight, which is why your medical provider typically is just going to prescribe a muscle relaxer. That muscle is tight for a reason. It's trying to protect your pelvis from getting either further out of alignment. And this muscle on this side is therefore going to be loose because the pelvis is pushed forward on that side. The glute muscles here, which stabilize the pelvis, are going to be very tight and quite often very tender right in the center of the muscles, where you're going to gain trigger points. And then the quadricep on the front of his right leg will be really tight as the pelvis pulls back this way. As the left side is pushed forward, it's going to tighten the hamstring. So he's going to have tight hamstring on the left, tight quad on the right. Both sides of his glute medius muscles are going to be tight, usually filled with trigger points if it's been there for a long time. This muscle is going to be weak, this muscle is going to be very tight, and the tight muscles are typically going to get trigger points in those as well and radiate that pain right up the spine. Okay, so we talked a little bit about how the lower back pain is tilted. These muscles here are going to be weak. These muscles here are going to be very tight, with resulting in a right short leg. Now these muscles come up and attach in the middle of the thoracic spine. Therefore you're going to generally get middle back pain resulting from the lower back issue of the pelvic distortion, and then these middle back muscles come up and they will attach up at the base of the neck and the trap muscles in the shoulders. When this is a chronic problem you've had for years and all you've done is take pain medications, over-the-counter prescribed muscle relaxers, these muscles are going to stay tight, and they're going to develop inside them what are called trigger points, which is a scar tissue. Trigger points grow, they're very painful, and they tend to get trigger points anywhere from between the shoulder blades in this area, coming right up into the traps, into the base of the neck. Those will regularly contract the muscles, making the pain come right up the neck into the base of the skull and result in neck pain, headaches, chronic tight shoulders, all resulting from the lower back. So what do we do that's different? We use a substance called serapin. Serapin breaks down the proteins that hold a scar together. It starts to break them down, and then we use physical therapy to start to realign and actually create healthy, functioning tissue again, rather than just that scar and trying to block it with medication. So thanks for watching. I hope we didn't waste your time. I hope you learned something. I hope it's something that you can use. That is the most common source of lower back pain in the world. In our office, we do regular complimentary consultations. So if you or somebody you know has a similar situation you think you might have, pelvic distortion or a short leg, trigger points, tight muscles all the time, pain, give us a call, 804-454-7240.